What I found astounding and what fascinated me, and why I'm an addictionologist today, is why is it that an individual would continue doing the same behavior knowing it's killing them, right? Why is someone, as an example, taking a hammer and continuing to hit their thumb when it hurts? Now, I get into this argument a lot with my peers and at family reunions about the disease concept. And I'm going to throw this out to you because I do teach, and I've been trained that addiction, whether it's a substance use disorder to alcohol or to heroin or cocaine or marijuana, take your drug, is a disease of the brain. What we say when we say it's a disease, we're saying that there are physical manifestations in what are known as neural pathways that are reinforced by the drug. People in the know in academia will say that the brain has been hijacked by these drugs. The pushback is it's a moral problem, it's a moral failing, it has to do with weakness of character, bad choices, and people choose to use. It's kind of like the argument you might have in college when you sat up all night and you argued, is there a God? And at the end of the day, it's 5 in the morning, you're both tired and you realize no one's going to win that one. I will say that I teach that it's a disease, but I understand why people come at it from a moral failing aspect. But the common ground, and I think it's important that we all meet here, is that we all agree that the individual that's trying to quit drinking or trying to quit doing heroin or trying to quit taking pills, they have a problem. And the etiology of that problem is not so important. But what are we going to do about the problem? That's what's important. What are we going to do with the individual? It could be your brother, your sister, your mom, your dad, a neighbor's kid that's struggling with this. What are you going to do about it? Because it's a problem. And I understand the hate, the pushback about how people can't believe that people drink too much or do heroin. Now, if you sit in my seat, and I'm going to be going to work after this, if you sit in my seat, it's mind-boggling what I have to see. 57-year-old grandmas addicted to heroin here in our community. This is tough stuff. 19-year-olds that tell me, I've been using heroin since I was 16. I go, well, why aren't you drinking like most kids at your age? Well, they card me when I go to get beer, Doc. My dealer doesn't card me. And heroin is all over the school. I think we all recognize that this is a complicated problem. There is no one fix for the heroin epidemic. But in our RIDGE program and nationally, although heroin's getting a lot of attention and pills, alcohol is still the problem. It's still the problem. It's estimated that about 135 million adults in the United States drink alcohol. Of those, 60% abuse alcohol. Only about 10% are, quote, alcoholic. That is, meet criteria for the manifestations of cirrhosis, encephalopathy, central nervous system damage, etc. Most people, though, are binge drinkers, and in our young people, this is a real problem. I've got 2 kids in college right now. We're not going to talk about the money there, but it's a fascinating. 90% of our young people under the age of 25 are binge drinkers. They're not drinking socially like most adults. They're drinking to get hammered. And today, in the United States, 6 people will die from alcohol poisoning, mostly under the age of 30. Because alcohol's a poison. As a physician, I recognize that ethanol, which is alcohol, the number 1 use of alcohol nationally, of course, is in gasoline as a fuel additive. And there are many routes of administration. Just to titillate you a little bit, you can vape alcohol, which is illegal in Ohio, by the way. You can use it as a mister. In England, they have mist bars where you actually walk into a bar, take off all your clothes, put on swimming trunks, and walk into a room, and they mist the alcohol, and you stay in there for half an hour and get drunk. You can butt chug. Don't go there, right? And you can actually use alcohol by what's called vodka eyeballing, the latest trend on the campus, where you take a bottle of vodka and you put it up to your eyeball. This is what kids are doing on YouTube. So I try to get the message out that, yeah, there are very many ways you can abuse alcohol, but it is the #1 drug of abuse in America right now that people seek treatment. Now, what's fascinating to me and what drives me a little nuts, only 10% ever reach out for treatment. Most never even want to get help. When patients come to our program, I interview all of them and ask them, have you told your family doctor that you've been struggling with drinking? Have you told your family doctor you're struggling with heroin addiction? It's very unusual for me to see someone that says, I did. Most don't tell their family doctor. Doctors need to be on the front lines of being able to talk to patients about a medical problem, because addiction is a medical problem that deserves and can benefit from treatment. Studies going way back into the 70s show that people that are addicted to heroin without treatment will just keep using until they finally pass away. Sometimes from heart disease, sometimes from an overdose, sometimes from contamination. They just keep using. Many people that abuse alcohol will just keep drinking. Now, I woke up this morning and I always pull off my news stuff off my phone and read articles. 2 articles right this morning. One says baby boomers, that be me, are drinking much more heavily in the last couple of years than ever before, and baby boomers are also smoking more marijuana. So people my age are using alcohol and marijuana a little bit more than in the past, and they think the reason for that is as we get older, life is a little harder. We don't feel as well. Physically, we don't feel well. A lot of depression. So the substance use disorder can manifest itself as a peak going on into older age, not only in our young people. I want to mention that although heroin has kind of been the talk, about 40,000 people this year have died from heroin or pill opioid overdoses, but 80,000 people will die from alcohol use. People go, well, doc, what's the gateway drug? And I say, well, it isn't marijuana. And they go, really? I thought cannabis was the gateway drug. And I go, I don't think so. I believe nicotine is. When I came into medical school back in 1976, when you walked into University Hospital, there were 3 cigarette machines sitting in the lobby for everybody. When I went to the pulmonary and cardiology conferences, everybody smoked. One of the things that our class did was to get those cigarette machines. Greg Ruan, who's the head of UC Internal Medicine over there today, it's one of the things that he did is he said, we got to get rid of these cigarette machines. These are patient-killing machines. So I look at nicotine as being one of the most addictive drugs and one of the most deadly. 450,000 people will die from nicotine-related causes in the United States this year. 450,000. That's about 1,300 people today. And yet, it doesn't get a headline. I'm always screaming. My mom and my grandpa both died from cigarettes. I think the MLB, the Major League Baseball Players Association, and you would know about this, has banned the smokeless tobacco for the ball players. And I think it's been banned for about 2 years with the minor leagues for the past couple of years. So they're trying to get rid of, because we see oral cancers related to nicotine. Now, when we look at the most widely used drug in the United States, I think you'd all be shocked. Does anyone have a clue as to what the most widely used drug is in the United States? Used, not abused, used. Yes, caffeine. And caffeine is, we get people at age 5 or 6 in their soft drinks using caffeine products. I'm kind of curious myself, why isn't caffeine a drug of abuse? Because you can develop tolerance to it. They say Voltaire, the great philosopher, drank 50 to 70 cups of coffee a day. And he lived to the age of 83, when the average age was 52. And we do know that, by the way, coffee is good for you, which gives me the great excuse to drink 6 cups a day. But it is interesting because we have withdrawal from caffeine. You can die from it. Anyone remember recently a death from caffeine that changed the law in Ohio 2 years ago? Up in Columbus, a high school kid ordered it off Amazon, some powdered caffeine, went into his bedroom, opened it up, snorted it, and died. And he drank the equivalent of 90 cups of coffee in 5 minutes. And he went into cardiac arrest after having a seizure where his sister found him. Kasich went ahead and passed a law within the next year. It is against the law in Ohio to order internet caffeine now, powdered caffeine. So we know that caffeine is a poison. You can have withdrawal, you can have tolerance, and yet we don't see it as a commonly abused drug in terms of needing treatment. And I think as a physician, I'm a little puzzled by that. The number one drug that we treat in treatment centers is alcohol, by far. Even despite the opioid epidemic, alcohol is the one drug. It's primarily because it's so widely available. But in your handout, I talk a little bit about some of the effects of alcohol. I think you're all familiar with them. Slurred speech, impaired gait, impaired motor skills, too much to drink where you get your blood alcohol levels very high. You can have nausea, vomiting, loss of compromise of the airway. You can die like Jimi Hendrix, gagged on his own vomit from being drunk. You can die like Amy Winehouse in 2011 from drinking so much that she was found dead from alcohol poisoning. Now the highest blood alcohol, and we've talked a little bit, I think, when they were mentioning DUIs and stuff, 0.08 is kind of that common threshold legally. There are people that drink regularly that can have a high tolerance, and they can be drinking with blood alcohol levels of over 0.2 and look normal. They will pass a field sobriety test. There was a case of a brain surgeon that was successful at doing and completing brain surgery. When he came out, the nurse thought that at the end of the case that she smelled alcohol, and he blew a 0.23, and he did a perfect surgery. So tolerance and the actual level may not always be the same. We know that with an overdose, if you get to over 0.4, you're at high risk for death. You can use alcohol as an analgesic. They did it in the Civil War. They did have morphine, but it was limited availability. And how many people were wounded on the battlefield? Bite the bullet, get them drunk. The problem is, getting analgesia with alcohol is very close to death, what's known as the LD50. If someone, and I tell this to the college kids, if you see someone that's passed out at 5 in the morning in the frat house, because I lost a friend in college from getting so drunk, he passed out on the tennis court in February at Kenyon College and was found dead. If you see someone passed out and you can't wake them up, that's a 911 emergency because they will be dying right in front of you. Kids that are binge drinking are at high risk for dying. So we see this, and I worry about my children. My wife asked me a great question many years ago. What are we going to do if our kids get addicted to alcohol or drugs? I go, I'll do what I do with my patients. She goes, whoa, gosh, what do you do with your patients? I go, I put them into treatment. I mean, what else are you going to do? This is a very painful thing. I also recognize that one of the great things that I love about my job, because I'm really passionate about it, is that when I help someone quit drinking heavily or quit doing drugs or pills, I've not just helped that individual, I've helped their whole family. Because it's not just them that's suffering. And when I see how, when that individual gets better, their kids are happier, mom and dad are happier. When you lose your child to drugs, it's so painful. It's like when your kid has cancer. Is there anything more horrible than having your child or your loved one, your spouse, your mom or dad, having a medical problem that could kill them? And with addiction, we see that it not only kills them physically, potentially, because in Claremont County, when I started working out there about 9 years ago at a nonprofit, I said, well, how many people are dying from opioid overdoses? They said, about 1 a week. And when I checked with the coroner in the last couple months, it's still 1 a week. I haven't made a dent, and I've treated thousands of patients. This is a horrible affliction that we're suffering in our community. And the costs go on and on and on with jails, CPS, kids getting put out for adoption, the incarceration costs, probation, follow-up. It's just a horrible expense, and yet behind all of that is the family that just wants their kid back. They want their mom back. So when I go to work this week, I'm going to be seeing some heartbreaking cases. Now, when I went to this conference out in New Mexico, yes, that was nice, one of the lecturers on addiction kind of perked me up a little bit because her whole take on it was that it's driven primarily by trauma, emotional trauma. That when you look at people that struggle with alcohol at any age, drugs at any age, deep down, there has a history of either witnessing violent trauma, being a victim of sexual trauma, being a victim of violent or emotional trauma. My take has always been that there's a genetic push to this illness because it tends to run in families like diabetes. We know that some of the studies that have done on twins show that if you take twins that are born, separate them at birth, and there's mom and dad are both substance users, they never meet mom and dad, they are separated at birth, they're put in separate homes, they have similar rates of substance use afflictions, no matter what the environment they're brought up in. That's the genetic model, where we think that the genetics play such a big role in terms of determining whether or not someone's going to abuse drugs or alcohol as they grow up. The real question that remains unanswered is, can we do anything about it? What can I do, knowing that there's alcoholism in my family and my wife's family, what can I do so that my kids don't get it? I don't have an answer. I can tell you what doesn't work is me going to a high school and giving a 1-hour little talk at a gymnasium, because I've done that for many years. Our studies show that that does not work. Me giving them a 1-hour little talk about the dangers, kind of like back in the 80s when they had your brain, this is your brain on drugs, and they showed the scrambled eggs or whatever. It doesn't work. We would like to think that education is from a parent to their children might help. We believe that kind of getting the change in perception is a big deal. Now, perception by young people is a real problem. We know for sure that if young people perceive a drug as less harmful, they're more likely to try it. And trying it is what gets us all into trouble. Trying heroin is not a good idea. And yet our young people don't think it's a big deal. Now, I think most of the adults in the room go, that's a really bad idea to try heroin. But for young people, they're like, it's not that bad. It's not going to be me, is what they tell me. Doc, when I first started doing it, I never thought I'd get hooked. In fact, I was almost like doing it on a dare. I dare you to try it, I bet you get hooked. Nah, I'm not going to get hooked. And some of my patients say, you know, if the judges and the police officers and my parents knew what it was like to do this drug, they'd understand my problem. Now, I've never done heroin, but I listen to my patients, I believe them. What we all need to do is somehow change how young people perceive trying the drug. And I go to websites that deal with people that are like bluelight.org. If you ever go there, these are drug addicts talking to one another. And what they all will say is, if you can, never try it. Because once you try it, you go into a new rabbit hole for life. It changes your brain chemistry, and it can be a lifelong journey of trying to never get off of it. I mean, it's a struggle for people. And relapse is defined by the AMA, the American Medical Association, in 1956. Alcoholism addiction is a chronic illness that relapses. Now, here's where I get into that sticky wicket. Just like I said, hey, addiction's a disease. No, it's not. It's a moral failing. We try to meet the common ground of saying, it's a problem. What are we going to do about this individual that has a drinking problem? Let's help that person. We also have the issue of whether or not relapse is part of the disease or if it's a choice. And I'm going to tell you, I tell my patients, relapse is a choice. Once you've had the benefit of treatment, you've come into a center, whether it's outpatient, inpatient, residential, once you've had the opportunity to learn about your illness, to know what we recommend as professionals what to do about it, which includes meetings, sponsorship, reading, lectures, information. At our Ridge, we do homework. And you then choose to go home and drink again. I believe that's a choice. So I'm telling patients, because they'll go, well, doc, relapse is part of the disease, and that's why I went home and got hammered. No, you made a choice. That is a problem. We are stuck at one very horrible moment when I can tell you there is nothing I can do about that horse that does not want to drink out of that trough. Nothing I can do about it. If you know a way to motivate a patient to want to quit drinking, to want to quit smoking the doobies, to want to quit doing pills to want to quit shooting heroin. If you know something that will motivate them to want to quit, please see me after the lecture. We're going to get rich. Because I have nothing right now that can really motivate. Look, it's not just us here in our community struggling with this. Right now, there's more heroin addicts in China than anywhere else in the world, except maybe Turkey, addicted to opium over there. I can only tell you that getting someone motivated to want to quit is a complex thing to do. And I will tell you that I think some patients really do benefit from legal intervention. Now, if an officer pulls over someone and there they are impaired from heroin, that's a real life-threatening and socially threatening kind of problem. They need to have a legal consequence to that because they could kill somebody, right? However, if they go into someone's home with an overdose and they've called 911 and then there's heroin there and they arrest someone that called 911 to help their person and they arrest them, I don't like that so much, but I would love it if they could at least refer them to me. Maybe threaten legal consequences, but I do know patients, and I'm going to tell you this, I've met patients that have good recovery, and they tell me, Doc, if it weren't for my judge putting my butt in jail for a year, I would never have gotten clean. So my patients are telling me the legal system, in many cases, has a benefit. As much pushback against the criminal aspect of being addicted is from doctors. So those are some of the salient features. What time do I have? I think I see Melissa waving, which means I'm going to start shutting up because I'm known to rattle on and on. My daughter says, Dad, you don't shut up. And I get that. So are there any burning questions from anyone before I wrap this up? In your handout, at the end, I've provided about 15, 16 slides that talk about OLAP, the Ohio Lawyers Assistance Program. I will mention that medical professionals and attorneys suffer from very high rates of depression, anxiety, job dissatisfaction, and substance abuse. And so we gotta get that. And a recent study that just came out of Hazelden that looked at lawyers nationally suggests that it's mostly the lawyers and people in law school under the age of 30 that are struggling with drinking and drugs. Stimulants, a lot of kids are using Adderall in college, and that turns into a chronic use situation. A lot of drinking to relieve the stress. Same with physicians. And there are big changes here in Ohio with the state medical board that has been going on with the Ohio Physicians Health Program that is not germane to this talk today. But I appreciate the opportunity.